So now over to Louise for the next session. And if you have any questions during this session, please direct message me or Brian with any questions. So over to Louise now.
Thank you, Meher. So for our last presentation of the day before our UW students will be talking, we have Dr. Leo Morales, Mr. Alina, and Ms. Rude, who will be presenting their findings on the impact of mobile health clinics and community outreach on global health. So I'll be introducing Dr. Morales. Dr. Morales serves as a Chief Diversity Officer for the School of Medicine. He also serves as Director of the Center for Health Equity, Diversity, and Inclusion in the School of Medicine and Co-Director of the Latino Center for Public Health. His research has focused on minority immigrant health, especially in regards to the Latinx population and its disparities. Patrick Alina is a program coordinator for the Bellevue Youth Link program, a premier award-winning youth leadership and community service program in the city of Bellevue for over 32 years. He has served this role. He served roles in developing innovative youth programming and community partnership. He has also helped develop a partnership between YouthLink and the Worth a Shot project with Meher in helping address COVID-19 education, vaccine resources, and other healthcare related needs. And Julia Rude is an internal consulate at the Harborview Medical Center at UW Medicine. She received a Master's of Healthcare Administration and a Master's of Public Administration from the University of Washington. She pursues a career in nonprofit and public hospital administration. During the pandemic, she led Harborview's mobile COVID vaccine program, which focused on providing vaccines to population experiencing disproportionate impacts of COVID-19 and barriers to access. So now I'll be handing over to Antonio, who will begin the Q&A session. Thank you.
Thanks, Luis. This first question goes out to Ms. Rude. We were hoping if you could talk to us a little bit more about what is mobile health, and a little bit of follow-up questions to that. Why is mobile health important in times of pandemics, and how are they relevant also globally?
Thank you. So I personally would define mobile health as healthcare services where we're bringing service and access to the community spaces where people regularly gather and spend their time in the course of their daily lives, as opposed to traditional healthcare services where we expect that patients really interrupt their daily life routines, travel to a medical office-based facility, and really come into that more traditional medical space. Mobile healthcare really takes services out into the community to meet the community needs where they are. And that may or may not include technology applications as well. And I think that mobile health services are very important globally. And I would say that in a way, we really look to global health services as we confronted the circumstances of the pandemic, and we said we need to do things differently in our practice, because there was a lot of great examples of innovative ways to reach community and to provide services differently. And prior to the pandemic, I think we were very focused on our traditional mental models. And so we actually were able to look to existing global campaigns, for example, polio or MMR vaccine campaigns, and say, these are good examples and we can do them today. So I think it flipped the script a little, that we moved away from our blinders around traditional thinking, looked at what was already being done, and said, how do we apply that in our communities?
I have a question for Dr. Morales. In your experience with underserved and underrepresented communities, what are some of the biggest factors leading to inequities, especially among people of color?
Thanks for that question. Hi, everyone. It's good to be here this morning, and thank you for the invitation. So I guess, we were going to talk about this in the context of COVID. And I think COVID has been, continues to be a great lens to see how structural inequities arise. So, this is a brand new disease. There's no reason that one group would be impacted more than another. And yet we see these very stark differences, both in terms of who is infected with COVID and then what the outcomes are of those infections. So there are large differences in hospitalization rates and also in mortality. The roots of this are not, they're historical, they're longstanding, and they have to do in large degree with, I think, the sort of how social determinants of health are distributed in society. And so practices that are related to how access to care or other services that are important in terms of health based on race or ethnicity or language or immigration status or a number of different individual characteristics emerge. So I would say this is this is not a new phenomenon. I think COVID has made it very clear, and we see it in our own backyard. Even if we compare outcomes between South Seattle and North Seattle, we see large differences. So that's in a space of 20, 30 miles. And we can see these differences emerge.
Thank you, Dr. Morales. Next question goes to Mr. Alina. Could you please talk a little bit about the role of community outreach in the setting of public health and how your youth group has contributed to this during the pandemic?
Sure. Thank you so much, Antonio. And again, I want to thank first Mayor and then the group that assembled this. This is really exciting. I'm jumping out of my skin listening to the previous session. And thank you, Dr. Morales, for sharing really the inequity that we see. I think what we found, first of all, let me take a step back. I think with the word outreach, I want to remind people, from my outlook, it's not an activity or a strategy. I think it's a reminder for us where we are in those systems. Constantly, we are part of all of those systems. And if we continue to look at outreach as we're outsiders, then we're never going to kind of get through other communities, right? So I think for us in this role, the program itself, it's a leadership program in the city of Bellevue. We have 80 youth members from middle school and high school and doing amazing projects. I think our role during the pandemic to do outreach was quite challenging in itself. As you know, there's a lot of fear of in-person and other barriers that kind of are obstacles along the way. But what we found was that people's connection was still deep in the community, and we had to find ways on how to remind people of those connections. And that role was critical in as we found in our process in disseminating and sharing information and resources around COVID-19, as well as the vaccine resources and so on. And it was pivotal for us to really take a step back and imagine our connection to those communities. I'm not sure if folks are familiar with the Seattle East Side area, but we have many, many different communities here in the East Side, where our community is 50%, over 50% other than white. We're a minority majority community, and we live in this very international community. And it was very important for us to look at the third places where people really spend time with people, other people, aside from their place of home and residence and work and so on. That third place was important. And for us during the pandemic, that third place was virtual in some respect. And it was really key and critical for young people to be part of that outreach or inreach work, because as you know, young people are very quick to pivot around communication and other nuances. So they immediately brought me to, hey, Patrick, have you thought about connecting with this community online or this community and so on and so forth? That kind of helped us get to the process of beginning our connection or reconnection during this whole process. So I think that was very important for us in moving towards this work.
Thank you, Mr. Alina. So this is a question for Dr. Morales. How can healthcare systems play a role in bridging inequality and inequity gaps?
Well, that's a big question, but I think there's just, what can we do? Well, I think one thing that we've seen. So let me just start by giving an example, because this kind of conversation can get very abstract. Very early on, one of the first things we observed was that in the pandemic, testing was really important in terms of identifying individuals who might need treatment, certainly needed to have some contact tracing and practice some quarantine so they would not infect others that they interact with, and specifically, and probably most importantly, people they live with. And yet we saw that testing rates were much higher in neighborhoods in Seattle where the infection rates are lowest. They also happen to be the more affluent neighborhoods in Seattle. Why does that happen? If we look at our own facilities at UW Medicine, we're located mostly in more affluent communities. That is not to say that less affluent communities don't have healthcare facilities, but they're not, I can say for UW Medicine, we were not there. And so mobile became an important strategy for us to reach those communities, but it's not enough. So I think we need to pay attention to how we allocate our resources when we look at putting new clinics up, who we're trying to serve. And of course, there are finances associated with that. So you have to have the financial system that allows for the delivery of services to those who most need it. I'll also say that, our strategy to reach communities that were being underserved in terms of testing and vaccination and now treatment really revolves around thinking about who is not well connected to a healthcare system. And that's a lot of people. Insurance is a step you need in order to have access, but it's not sufficient. So lots of people have insurance, but no primary care provider. Lots of people don't have insurance, and so don't have a usual source of care. So when issues come up like, how do I get treatment within 5 days for this infection? Like COVID now has oral therapies but need to be given within 5 days. It's a really tall order. So I think we need to solve access issues, and we need to think about geography and certainly history of those neighborhoods that are not well served currently, and how we can, really change the way we're delivering care. I just wanted to mention, Ms. Rood's comments on getting out of our building. We can't just open a clinic. We have to be in the community where the community needs us. And it can't be only for the COVID pandemic. So the one critique of sort of the so-called vertical programs that go in, say, to eliminate polio is they do that, but they leave behind everything else. And I hope we don't repeat that with COVID. We needed to go into the community to vaccinate and to test and now to treat. But there's so much more in terms of health inequities there. We need a much more sustained and broad-based effort.
Thank you, Dr. Morales.
Next question's for Ms. Rood. We've been talking a lot about the health inequities, and we were wondering, how has UW Medicine utilized mobile health services to bridge those gaps, bridge those health inequities?
Yeah, so for our mobile program, we really took our time we moved fast, but we also really took the time to have conversations about how we would design our mobile services to make sure that we really are reaching the right people, the right communities that need those services. And I think two pieces were equally as important in making sure that we were digging deep and getting to those inequities. When we really did look at our data internally as well as public health data to see where we saw areas where the rates of COVID infection were disproportionately high and mortality from COVID was disproportionately high. And then we married that up with data around our vaccine rates, and where we saw uptake was a little slower. And we really wanted to target those areas and locations and communities where we could see that dynamic. But equally as important was we reached out to community partners that we had that were nonprofit leaders, they were government leaders, they were faith leaders, even just community leaders that maybe had businesses. And we started to have conversations with them to understand what are the barriers. And as we get ready to provide COVID vaccines and we want to reach communities that have the lowest access, how should we do that? What's the most important ways to reach your community specifically? And we didn't use a one size fits all option. We looked at, for this community, how do we design this event to be most welcoming to this community, to be in a space that reflects the community and they're comfortable at, that there's a high level of trust, and how do we make it at a time that works for that community? So there was a lot of that conversation before we ever started delivering vaccines. And I think that's what set us up well to have good outcomes when we started doing events. And for example, we got a tip from a public official, and she helped connect us to an apartment complex where the owners of that apartment complex were supporters of vaccination. And they recognized that they had a large Latino community that they were part of and that was well represented in their apartment complex. And so we reached out to them and really said, what's the best time, place? How do we bring in services that are going to fit your need? And so we went on a Friday evening because that's when the community gathered. A food truck would typically come on Fridays and the community would gather. And because we had the support of the apartment managers that brought us in and welcomed our team and helped us fit in to the community, set us up on the basketball court with our mobile van right in the center of things, we were able to be there with the community, not in a cookie cutter way, but in a way that provided access that was comfortable to the community. And another part of our outreach was that we went back multiple times. We didn't go in and have one event and then we were gone. We had a sustained presence. We got to build relationships. We got to know people, got to earn the trust of the community. And so a lot of that was the people connection was really important to getting to folks that were not being served through the traditional medical complex. So those partnerships were really most important for us. And then after our events, we would go back to our data because we did collect race, ethnicity, and other data markers. And we would say, did we reach the population that we intended to reach? And if not, we'd go back to our community partners and say, what do we do different? Where do we go next? So it really was this iterative process where we were using data to understand where we should go and help inform who we should reach out to, having those community conversations, and then having the event and looking back and saying, okay, where do we go for the next time? What do we need to tweak to make this right for the community? And our outcomes really did reflect that approach was very successful in reaching the communities that we were trying to reach.
Thank you, Mr. definitely shows like the very complex and intentional kind of thinking that went behind crafting the approach. Next question is going to be for Mr. Elena. You helped launch community conversations during the pandemic. It was a series of educational webinars. Can you talk about the impact that they had?
Sure. Thanks for that question, Antonio. I alluded to share in the beginning when about our group is that we have an action team component where it's comprised of young people with adults working together to work on specific projects and focus. And that's the practice arm of the program. On the onset of the pandemic, a lot of our young people really brought up to our attention about the need for not only information, but resources to other communities. As you can see, folks were really inundated with information, head on the swivel, a lot of things going in all directions, in all bandwidth. So the true design for this action team, it was called Youth and COVID Support Action Team, was really reverse engineered around the need of those community. And what I mean by those community is that, like it was shared earlier, that different groups, like at the schools, like we seeked out the affinity groups in different communities that were really assembling and meeting. And those are the things that we heard, that the needs that they had around this information and the resources. So based upon that information, our team, which is just a small cadre of young people, like around 8 to 10 people, started to seek out partnerships who are folks that are already doing the work in the community. And Meher, who's been working on a wonderful project that she started, Worth a Shot, we connected with her and discussed on how we can best share out the information that she has been working on, researching, and so on. And we partnered with local medical providers, folks in the front line that are doing the work, whether they're immunologists, pulmonologists, working the front line, have real time and data, real information and data around COVID-19 and other resources. We're in the forefront of answering community questions. And so it's more of a dialogue. I think we produce around anywhere between 10 to 12 sessions, around 1.5 hours per session. And it was a lot of information, sharing out specific information that community members needed. I know that there was a lot of hesitance as far as like, what is the vaccine about? And, should I get this? And they had a lot of questions around how it works. So those were all answered during the presentation. And what we found during that interaction was that it really helped when the school district and other community agencies, public health agencies, sponsored pop-up events throughout Bellevue and the East Side. It really demonstrated the importance of having that bridge and connection of the information to the resources and to the people that are administering the services. So all in all, I think that was a great testimony as far as the importance of the workshops and the information. But also we found ourselves also being on the receiving end of feedback of things that they heard that they, things that they heard within their community. And there was really not a channel to kind of share that back up to the channels. And our youth team designed a youth survey that went out to different community groups, again, the youth providers and so on. And we got some interesting data around the hesitancy around vaccination and just resources barriers in the community. So I think that was really the makeup of that project. And I wish we had 2 hours in this. This is amazing stuff that we're all discussing. And I think this just proved to us, as Dr. Morales said, it really unveiled a lot of inequities, but more importantly, it also unveiled the connection, interconnectedness of those communities.
Thank you,
Thank you,
Mr.
Mr.
Elena and Ms. Arud. I have another question for Dr. Morales. How can young people play a role in addressing inequities in terms of volunteering or community efforts?
Yeah, that's a great question. Thank you. So I do think, like Mr. Elena was just saying, youth are so important. I think in reaching, we have to think in terms of families, I think. and young people, not necessarily the youngest children, but young people are great connectors. So I think and so peers, reaching out to peers is powerful. So I think there's a great role for young people to play in terms of COVID, and other sorts of other health problems as well. I know within our own program this summer, we have probably 4 or 5 summer interns, students. We have who are of high school age and college age that are going to be helping us implement our outreach strategy, including online. So one of the strategies we've used is trying to work through online influencers to talk about vaccines, how to find vaccines, to answer questions about vaccines. And even though it may not be the channel of communication for the elder folks, although I don't think that's necessarily always the case, it's the young people in the home that can make that connection. So yeah, I think it's family units, and young people are connected to families with parents and grandparents.
Thank you. And a follow-up question for that, just to build upon that, any of the panelists can answer this, is like, what are some of the careers for high schoolers like who want to work in public health? Like, what careers besides like medicine and physiotherapy and all that?
Well, I'm happy to start. When I was in high school, I had no idea of the number of different opportunities there are in the health professions. And so I would say I could start naming different health professions, physical therapy, occupational therapy, prosthetics, within public health, there's occupational health, there's behavioral health, there's social work, there's pharmacy, there's health administration. So there are so many different roles to play. And I just think it's a matter of exploring and how to get connected and started. I think any one of us could probably steer young people towards a potential area of interest. There are summer programs that students can get involved in to kind of help get to know, connect, network. And so, I think there are just as your imagination isn't enough to really capture all of the different opportunities out there.
If I may add also to that question, in my previous life, I worked for the National Community Health Services in partnership with CDC and the Federal Office of Population Affairs as a health educator working on API male reproductive health needs. And what I found through that experience was that I think when we talk to young people about, whatever that career pathways are, I think I would offer up also like a community organizer role. I think also anytime you can engage in the community in many levels, like Dr. Morales said, whether you're in front facing or in the back end, I think it's important to see there are many opportunities, whether you're working as a project coordinator or what have you. But I think it's so essential for young people to really begin to explore things outside of the traditional role of medical field opportunities. And there are many. So
Thank you so much.
I have a follow-up question for you, Mr. Lino. You had mentioned in previously talking about how the pandemic showed the disparities, but also the interconnectedness of community. I was wondering if you could expand a little bit on the role of volunteering and community partnerships in global health, and if you could also talk a little bit about the community groups' impact on population health during the pandemic.
Sure. I'm a big proponent of community health facilities. I think it's all central to some of the services that families seek out for services. And one of the things that the role of volunteering is I want to just say that volunteering is, again, it's not just an activity. I think it's what we need to see ourselves as part of that system. So whatever work we do is part of that system. And I think young people are they're natural connectors. Like I think it's said already by panelists, they're natural connectors, they're natural optimists and futurists. And it's so amazing that that when we put people on the helm of things, whether it's community service or leadership development and so on, they really take on that role and take on, the onus on as far as like the responsibility. And volunteering for us at least for the Youth Think program, it's holistic. It's like not just one aspect of a project, in whether it's this project that we're working on with COVID-19, but it's also like addressing other social justice issues or addressing food insecurity and so on. So I think the role of volunteering and partnerships in the global health setting is really, really critical, but we have to really open up some channels as far as where young people can volunteer and be engaged in many different levels. We have to look at the social capital that they bring in. They're really knowledgeable of a lot of things, whether it's from tech all the way to like making presentations. So there is a lot to say around this topic, but I really am a big proponent for that third place where young people, families congregate, and we need to center our work and services around where they are, not to bring them into facilities sometimes that might not work for them. So.
Mhm.
Thank you, Mr. Lehman. Thanks for the reframe and refocus on kind of a more holistic approach to volunteering. Next question's to Ms. Rood. What are some of the challenges to mobile health currently?
I think one of the most significant challenges to mobile health is that we don't really have good funding systems in place to do mobile health at a large scale or sustainably. And when we look at our healthcare system infrastructure, it's very rules-based. It's really centered around our billing models, our insurance models, and those models don't necessarily incorporate mobile health at this moment in time. So when we went ahead with our mobile health program, we were fortunate that we're a large facility. We have good connections, and we're able to reach out to foundations to help fund our work in this area. And I think that was something that would be a lot harder for smaller groups or to do in a setting that there wasn't quite the burning platform of COVID, this immediate sense of crisis. So our system is not yet well set up for sustainably doing mobile, and right now it rests a lot on philanthropic donations. So I think that's the biggest challenge, is moving from this current state to a future state where it's more every day. It's not a crisis response, that we've normalized mobile health services and incorporated them into how we deliver care and how we fund care.
Thank you. And I had a follow-up question for you, Ms. Rood. Do you have any upcoming projects?
Yeah, so we have been looking at how we provide our therapeutics, so Evusheld, prophylactic, and how we provide services for long COVID treatment, and how we provide those services in a way that is continuing to break down healthcare inequities. So that's our big focus on the COVID front. But we're also having conversations about how we move from COVID to keeping these relationships alive and these innovations in how we deliver healthcare alive, and how do we apply that to other care needs like diabetes? How do we apply that to mental health? How do we continue to work together with our partners in the community and use that same model of really listening and co-designing services and then providing them where the patient is at and is most comfortable rather than in the traditional medical setting. So we're still in that designing and thinking through next steps of how do we move from COVID into the next phase where we apply those lessons to other disease states and to healthcare in general.
Thank you, Ms. Rude. This is a question, all the panelists can answer this, but Dr. Morales, how do you envision young people acting as COVID vaccine ambassadors in the community? And how do you think these will affect vaccine hesitancy?
Yeah, thank you for that question. I'm going to first just say a comment about what Ms. Rude was just talking about. I really do think one of the fundamental issues is how we finance healthcare. We need to move to healthcare for everyone. Without any sort of financial barrier. I mean, now you have to have a job with health insurance, and even then it may not be enough to give you all the coverage you need. And a lot of it is the ability to pay that determines what kind of care you get. We need to make that go away. I think so. Young people, I would call on you to become active and advocate for healthcare for all, regardless of ability to pay. So your question around vaccines specifically, I think, like I said earlier, young people are within family units. I think if young people can become more informed, if they aren't already, about vaccine issues in terms of safety, in terms of efficacy, you'll learn some science, and you'll also can then speak to your family members, your parents, your peers, and elders, whoever you happen to be around, about why vaccines are important to get, what kind of impact they can have on your health. And that's a fantastic role. And so any way that you can do that, either through interpersonal interaction or through social media, I think that all is really helpful.
For a question for all the panelists, what can communities do to uplift the voices of young people, and how can youth involvement in these mobile health efforts help amplify these efforts?
I think one great example that I saw in the course of our work was we partnered with the African American Health Board on some of our COVID vaccine events. And one of their leaders is also a leader at Seattle Public Libraries. And she held a design event with youth around how do you promote COVID vaccination and what are the advantages of COVID vaccination. And really, that group brought a lot of creativity, and they were able to really craft messages that focused on not just the science of it, but the take home of this is how it really affects us holistically. And it really empowered them to be creative in their expression of the impacts of COVID, and then give a platform for how they shared that out. So I think that was one example of a specific program, but the kids that participated in it then went on to have those conversations with other folks. I think they each had a goal of having conversations with 5 other people. And that was a way that they were able to then take what they had put together and their internal conversations as a group and start to distribute it out through community. So I think there are specific opportunities, but you can also, on a day-to-day basis, apply those same skills of going out and having conversations, of being able to articulate what you're seeing and the impact that something has on you and your ideas about how you can change it or impact it.
Thank you, Ms. Rude. And a follow-up question is that you just talked about health boards right now. So how do community-based health boards play a role in mobile health? And how has it been beneficial to have these health boards represent specific communities, especially during the COVID-19 pandemic?
And the health boards were really key to a lot of our mobile engagements because they were that voice that we could go to and say, okay, you know, how do we design an event that's going to best reach the community that you represent? You know, where is that? What other services should we package into that same event? What does that event look like? And they were also really the voice of the community in terms of spreading the word, of making sure that people were aware, and emphasizing not just the COVID vaccine, but the other services or the other aspects of the event that were going to draw people in, whether some of them used arts as well. So it was an event that wasn't just focused on COVID vaccines, it was also a community event. So they were the ones that were really able to say, this is what's going to draw our community in, help make it a welcoming space, not make it just a focus on vaccines, but make it a place where there's resources, one of them being COVID vaccines, and we can support the community that's really been impacted and not been able to gather because of COVID vaccine, because of COVID.
Thank you, Ms. Rude, for your inspiring message.
You know, that I would add, in addition to, but similar to community health boards, are community health workers. So they've played a huge role in terms of outreach to communities. So not community health workers sometimes are organized into groups. Many times they work though individually, but they are members of communities. Frequently, they're unpaid volunteers. And, you know, the whole issue around volunteering is kind of complicated, I think, too, because, you know, a lot of the work that's being done on a volunteer basis really deserves to be supported financially. And that's particularly the case, I think, with community health workers. But that's just another model. For youth, I don't know of a specific program for community health worker that are youths, but I can't see why that couldn't be the case. I don't know, maybe others on the panel are aware.
I think if I may add something, I know I just want to highlight again Mayor's work with the Worth a Shot. It's a great example of like centering young people to mobilize quickly to get you know, this work out quickly. And I think it, like Dr. Morales said, I think it's amazing how much they're able to bring in with their network of people to do the work. But I think what we're finding ourselves in a position is to be conveners of other groups that are doing amazing things. And I think that's part of the legwork here, really, for all of us, is to find those channels to bring people in and as much as we there's a lot of scarcity around some of these resources, but we also find that there's a lot of abundance in some of the projects that we're finding with regards to people willing to, you know, provide sweat equity, provide their time to help produce something and give something to these projects. So that's just what I want to share with regards to that kind of partnerships.
Thank you, Mr. Lina. I actually had a follow-up. In this conference, we talked a lot about non-infectious diseases as public health threats. How do you see programs like YouthLink addressing inequities through efforts like coat drives and food drives, helping better the health of the public? Because we know it's a connection that isn't talked a lot about, like kind of addressing the non-infectious health equities that we see.
And I think it's that approach, right, of the holistic being, right, of everything in totality, what they need. And one great example, like what we found was during the whole time of the pandemic, the quarantine, is that the biggest emerging needs is youth mental health, right? And I think from working with young people, it's so important that when we talk to them, we engage with them, that we don't have this myopic perspective of like, I'm here to fix one aspect of the problem. And it's a holistic thing from their, the insecurities of around food and housing and other social needs that has to be all factored in. And I think what, we really have to foster this approach of not only that one aspect of that need, but also, again, the cultural lens, that optic is so important, identity. I mean, we can talk on and about the inclusion piece, but this is something that's major when we do the work. It's like, it seems like things are prescribed and given out to the community, like here's a prescription to this, the issue that we're seeing. But I think more and more the work that we do has to be holistic. It has to address all of those levels. And I think the community sees that, and I think they continue to engage with us, whether we approach them for here's your the support for clothing needs or what have you, and they'll bring up other things that they need and so on and so forth.
And thank you for the challenge to kind of the single issue focus and kind of bringing in a more systemic perspective in terms of addressing health inequities.
Yeah, thank you, Mr. Lina. So I have a question for Dr. Morales. Could you please talk about, since you're the co-director of the Latino Center for Health, could you please share us a little bit about your work as a co-director?
Yeah, sure. So we are a multidisciplinary group. We're funded by the state. So we have funding from the legislature to work on issues that are related to health and well-being in Latino communities. We have done a number of different kinds of projects. So we've done work on occupational health issues. We've done work on workforce. So one thing that was just being mentioned that, we have one of the issues has been not a very diverse workforce, one that can't connect with the communities that are most in need of care and outreach and connection. Like you have to be able to connect and feel comfortable with the provider that you're seeing. You're more likely to connect if you see someone who looks like yourself and has a similar background and identity and life experience. And we don't have that. So we've done some work around that. And most recently, really, the focus has been on COVID. So we've done a number of different policy briefs. We've held symposia where we bring together individuals from across the state who are working in Latino communities. And Adios COVID is a project that has been hosted by our center and is a collaboration between us and the information school, the iSchool, to help test, vaccinate, and now treat people with COVID. So yes, and when I mentioned we had 4 students joining us this summer, it is the Latino Center that's hosting them. So we do work with students. We work with, both on a sort of summer intern basis, but also on a research project basis. So those are individuals who are seeking masters and PhDs.
Thank you, Dr. Morales. And this last question to Mr. Lina. We've talked a lot about kind of the role of volunteering and community partnerships in kind of rethinking, kind of moving away from single issues and kind of thinking more of a systems approach. Do you have any other thoughts to share in terms of changes that we need to make at the grassroots level and population levels to brace for the wider community health needs?
Yeah, I think I want to speak first to the adults. And I think I for one, I'm 46 years old, and I think I still suffer from adultism. So I think we really got to take a step back. And if we really want to address whether it's local, community, global health needs, if we think, we say, we do that young people are at the future, they are now the future, they are now the leaders now, not the future now. So we need to take a step back and really let them be at the helm of all of those work, whether it's from program level to policy level work. Take a step back and let young people take that helm. And again, I'm speaking to the adults. I mean, I think I'm fortunate to be in this space with young people every day in, day out, with whether they're working on projects or across bargaining tables or speaking to council around their needs. It's amazing to see them at work. And I think what I'm seeing now is that more and more young people are not waiting for systems change. They are the activators and engagers for those change. So they're not gonna wait for a large system change, okay? So be ready for that, take a step back, and either you co-create stuff with them or you let them create it, okay? But I think I'm a big proponent advocate for that approach. And I think lastly, in all of the work that we do, we really gotta look at inclusion work and the work of how we engage community from the perspective of the community. And I think that's so key and critical.
Thank you so much.
Unfortunately, we won't have enough time for audience question, but thank you so much, Dr. Leo Morales, Mr. Elena, and Ms. Rube, for being able to share your experiences with your mobile health clinics and community outreach on global health. Thank you so much.
Thank you
I'll
so
hand it
much.
off to Mayor.
Thank you,
Yes,
everyone.
and thank you so much to all of you. And Mr. Lena, you've been an amazing mentor for young people for such a long time, including me. So thank you so much. And for all your inspiring work, especially the community-based work. I think that it was a wonderful panel, very fascinating discussion. It gave the conference a unique community-based twist. And I also felt that the work you described aligns so well with the mission and values of Worth a Shot. We've also been doing a lot of work with mobile health efforts, working directly with communities and with our local public health departments to organize vaccination clinics, free health camps in the community. So these are all volunteer-led. We could see a lot of connections there. And now we're expanding to a more global perspective. As we can see with this conference, we have people here from all around the world. So thank you so much to all of you.
Thank you. Bye-bye.
Thank you.
Thank you.
Thank you.